is it normal for my vision to get foggier? Um, so that's an interesting question. We'll break it down to time frame. So after surgery, your vision can be foggy, particularly if you had cataract surgery, you had pretty dense cataracts. But that fogginess usually gets better day after day. And depending on how dense your cataracts, that may take about a month to recover. It may take a few days only. But it usually goes in one direction, and that's to less foggy. And similarly for RLE surgery, things can be a little foggy in the first couple of days and then get less foggy. Now, if things get foggier, that would be uncommon in the first month of surgery or the first couple weeks of surgery. The most common reason that happens is if you heal just very robustly and you develop the posterior capsular opacification or the scar tissue formation around the lens. Some younger folks, people under 60 years old, that can happen very, very quickly. I've seen it happen within a week of surgery in someone who just, a young person who heals really well and this scar tissue forms very quickly. We simply just take the laser and remove that scar tissue and restore you back to the great vision after surgery. What are the situations that it could be that during the healing process, the lens can settle in a position that's unexpected, more forward or more back. It's called the effective lens position or tilt. And it doesn't necessarily make your vision foggier, but it can make the focusing, your vision out of focus. And so you end up with a residual refraction. And those are cases where we'll provide you with a temporary solution like contacts or temporary glasses. We wait until everything stabilizes and we have a consistent refractive error. And then we can do a follow-up surgery to resize the power of the lens by explanting the old lens, putting in the new one to account for tilt and effective lens position. Or we can do LASIK surgery to touch up the residual refractive error. So there's many options we can take there. Hope that helps.